Obese men are ticking time bombs when it comes to developing low testosterone, infertility, erectile dysfunction, benign prostatic hyperplasia, blood clots, and even potentially lethal ones, as well as potentially bladder cancer. However, with as little as one or two rather simple interventions, all six of those nasty issues could be completely eliminated. Now, some nuanced explanation of the six issues I did mention is needed because understanding the issues will help you understand why and how the strategies that we implement will help, but also because, well, there's a set of tools in this protocol that can be wielded very safely, and they can be a really good addition to your arsenal, especially if you're an obese man or you know an obese man that you care about. But if haphazardly jumped into without proper guidance beforehand, these tools can be somewhat of a double-edged sword that cuts the wielder. So the main issue here is that obese men obviously have a lot of excess fat, and excess fat or adipose tissue has a very dense expression of an enzyme called aromatase or CYP19A1. What this enzyme does is it converts testosterone, the so-called male sex hormone, into estradiol, which is the most predominant and potent form of estrogen in the male body throughout life. So all of that sounds great, and obviously it is. Without estradiol, there is no life, okay? But too much of a good thing can be a bad thing. Now, estradiol plays what's called a negative feedback role in this axis. So if estradiol concentrations are excessive, it inhibits GnRH synthesis and release at the level of the hypothalamus because your body doesn't want to produce too much sex hormones. It can be damaging. So not only can estradiol be damaging in excess, testosterone can be as well. And this is going to inhibit hypothalamic GnRH release at a very potent level. It's going to be to an extreme extent. And this in and of itself is going to lead to low testosterone. It's going to lead to infertility in a lot of men, and it's going to lead to erectile dysfunction.